Well, it's the first day on the job for the man in charge of that healthcare venture formed by Amazon, Berkshire Hathaway, and JP Morgan Chase. His goal? Nothing short of bringing costs down and changing healthcare as we know it. Meg Terrell has more.
It's a tall order. Fix healthcare not only for the 1.2 million employees and families of Amazon, Berkshire Hathaway, and JP Morgan, but also aim to create blueprints for better care at lower cost that can be emulated nationally. And on day one for CEO Dr. Atul Gawande, even the name of the company isn't known. Gawande has been referring to it as ABJ for its three founding companies. What is known, it's independent, based in Boston, and not for profit. Beyond that, some is known about the enterprise's mission. And from recent speaking appearances and previous writing in the New Yorker and elsewhere, there are some clues about how Gawande may seek to accomplish it. First, the goals. Gawande spelled them out recently at a conference in Aspen.
I get to have 1 million patients that I, as a doctor, get to add to my responsibility. And my job for them is to figure out ways that we're going to drive better outcomes, better satisfaction with care, and better cost efficiency with new models that can be incubated for all. That is a tall frickin' order. But, you know, what they're saying for me is resources won't be the problem. Human behavior will be, and achieving scale will be.
Gawande laid out three sources of waste in the healthcare system: high administrative costs driven largely by middlemen, second, pricing, and lastly, misutilization of care, what he said was the biggest contributor to waste. Gawande defined it as the wrong care at the wrong time in the wrong way. And it's the topic of much of his research and writing, including the 2009 New Yorker article that so impressed Berkshire's Charlie Munger that he sent a $20,000 check to Gawande sight unseen. The biggest knock on the surgeon, writer, and public health researcher as he begins this new venture is that he has never run a major health company or system. But Andy Slavitt, who ran Medicare and Medicaid in the Obama administration, argues instead that's a strength. Many, including Gawande, expect progress will take time, but say it's not only possible, but much needed, as healthcare now accounts for 18% of the U.S. economy. For Nightly Business Report, I'm Meg Terrell.